inside this edition of the Breakfast Show today. We will continue with the discussion we get for do with Kush. One aspect of and where plenty people not on the talk about now the condition where some of the one them we can take Kush can they pan before then they die. Also we can see some of them can get sores and people only ask question how they can lead to this particular stage where can make some of them not able for survive. Well, today at the Breakfast Show, one of the director of communications in our state house, Mike Berewa, we get knowledge on the medical field. They can explain to with the perspective of this particular Kush, how it affects people to a stage where they can get them so then they before then they die.
And na the liquid the way I make mention, so then are the ingredients the way they take make them with. Now, people that don't see say people they take them in there a lot. So the one that where they overseas, they don't get into that business day for make them buy them in ship and canna salon. Where then ship and canna salon, Khadija and Mabel, the person where they make Kush, Ibrahima they make Kush, and your ingredients where they take make Kush is different from what Muhammad they take make Kush with. So their substance and they are legal, they becomes illegal where the final product of the Kush you don't make her. I don't know if I explain it better that way. It is not legal until the final product, so you don't mix all the thing and it becomes Kush, then it becomes illegal, it becomes a drug.
So the Kush, not to like, for example, then go buy it tramadol, the 225.
No, mama.
No. Not just substance that we different one. And
so you go find out, say, if other person there, sometimes they even take diazepam, they take tramadol, they mix it. Some man they mix out jamba, some man not with marshmallows. Some man they mix out kumbe jaga. Some man and they mix out with how you call it, human bones. The reason why they even go take the human bones, they find out, say, the kind bones they go for, now bones they are more of Christians them. Because you know, say, Christian died and they preserve the body first, and they get it for malignancy in bone, and they did it for some time before they bury them. So now them bones and then they go in for, because it gets high sulfur density back, where they make them feel high. So now we understand as people say first, the reason why it's difficult for government for FETA, now because of them thing they want to explain so. Right? If we say now, okay, let's stop left formalin not come inside this country, I'll get for preserve body then. If we stop say let acetone not come inside this country, how? Yes, government gets a responsibility for see how you regulate them thing and day. That's where government comes in. For see say, okay, now know whether they buy them thing they come out inside this country. Now we make sure say, I mean certain amounts the way you go buy Mboku, you make sure say, this is too much. You don't get what they can do with them. This is not for you sell no more than 1 gallon or 2 gallon you buy, and 3 gallon you buy. Why you bring 300 gallons? So that is where government comes in to make all those regulations. But all the regulations there, my sisters, it has to take place wherein the laws get for enforce them. In a sense, they get for enforce the parliament passer. They agree say yes, these are the regulation through the pharmaceutical board. They agree say yes, now these are so amounts for come with if you exceed so amounts that crime. All and we've not gotten there yet as a country. So for me, my argument has always been this. That's why I don't want people to politicize this. We say we need for really enforce the law at the production sites them. The one where they make an the host. Khadija Mabel, everybody knows somebody where they make them in this.
So Mike, the one them where fingers on the point at say, now then they bring the Kush. Even I know say
Kush.
Fine.
Bring the ingredients.
I know say beaucoup person where they listen to you now, beaucoup people not today them go learn all of these things where they explain say now different thing in the mix until they become Kush. The one them with fingers on the point at say now then they bring so not to the Kush itself and they bring the different mixture.
Now the ingredients Ms. Khadija, now the ingredients they bring the acetone, the formaldehyde, now in liquid forms then they bring the one them back where get money where they like overseas then can buy like the marshmallows.
So where the leaves?
Now the marshmallow, but the leaves also not leaf now. Like I tell you, then they make us tea. Like I get green tea, you get black tea. People they can come back for good thing. So now when they put all the ingredients they have together, then it becomes a drug. So the greatest problem na ya ide outside the maker. Yes, I know they tell you say let government not put regulations on how they come. Law no watch how people they bring and come. Because I mean, for instance, if you bring like you don't get hospital, you don't get pharmacy. Khadija, if you bring like 300 bottles of acetone, you bring 300 bottles of formaldehyde, all them liquids in there, that they raise some eyebrows, right? Government for put regulations, which I perfectly agree with. I haven't spoken to pharmaceutical bodies for really. That's what I want to learn from. For see what are the regulations so they don't put in place for all anything there. How are they monitoring? What are our controls? What are the policies them all don't put in place for make sure say then thing there way they come inside this country. Yeah. But for now, we must effective approach to this thing, not to politics. Now waiting. Now for break them production sites here. Who's then they produce them thing, now when they manufacture, then get labs and what then they do.
So then different ingredients there where you don't name, where you say na in they bring then mix them, process them, then turn it into the kush. Medically, uswamp and then we get the effects of them sauce there where they come out and the kush people addict them.
So to be very sincere, there is no scientific correlation where they say nah that's the cause it's all.
But
So-
all where they take the kush, then
They
get
get so-
similar.
So
effects.
make I explain why that happen. So when you take the kush, I mean you get certain parts of the brain where na the kush they attack. Where the brain come, they begin hypnotize, they freeze, you don't get what I mean. The bad thing about that kush, the active ingredients that I already talked about, so then this acetone is so addictive that when you take them, you always want to forget more. So then people they are when they take her, maybe they know they even get feeling for it. Then they become very emaciated. What I mean by that, then they become very malnourished. Always they want to crave for it no more. So if they know they eat what's in they happen, then they become malnourished, then body they done, they know they get enough nutrients inside their body. And guess what? Because of the poor hygiene then they begin get how you call them? Corona them foot. So if small scratch come na them foot, they get what they try for talk. That scratch they and they become a sore. Why they become a sore? Because with all the active ingredients they are when they take, so when they mix so there is no I want to take me time later. So there is no definitive science, peer-reviewed science where say I get some vascular or peripheral problems where they affect the lower extremities. No science not prove that it. But if you look at the studies now, see, waiting psychiatrists then they point to say because of the poor hygiene, because of the poor malnutrition, we then get so food. That's so food for like well, not well. You get what I mean? Because one, oxygen deprivation they take place they down there. Two, the sofute become dirty, they know they clean them. Three, they become gangrene, and at the end of the day, that sofute will get infected and they get something called sepsis. Sepsis na a high level of bacteria or toxins and we don't come inside your system when they kill you.
So the argument here now, Mike, is if not to the kush itself, or they take directly they cause the sore. How is it possible, say, most of the way they come in contact with the kush must get a sore before they die?
Now make I explain to you. Say when they take some then they take the kush don't get sore also. Someday if you find out
Most of them they put them more swell.
Yeah.
They like the sun not visible, but you see them body parts and
yeah,
swell.
now make I explain. So no science, no the way. I would like studies. I would like for somebody show studies on that. I would love to read it. But there is no science where they correlate directly any peripheral problems with them thing and the way they take. So for instance, I'll give you a narrative. That bubble where they take kush na us, we come up from home because the thing they affect homes now. Get mama, papa, sometimes they go school, na private school, they go, they get everything way, but they still take them. It hardly for like you sit down there and put panam. That's all the panam. But the one where they're at the street, where they always throw with them foot, where they always they pass, they're exposed to a lot of cuts them, when they get cuts na them foot or any break na them body, that break the problem is for like well, I know the well. Because one, the dirty they so if they find out say if you get some agencies or some hospitals where they do charities, where they go out to go take them, then clean them, foot them, then ban them. But ideally, if wound care you need for do them like 3 times a day, you get what I mean. So somehow when them ban that thing, you say don't dirty the way you pass near you say, I mean care not day. So if care not day for that wound day, another well. Another well. I will give you a scenario. What will be small, or they play football, where you get cacked to. You know what like mama knows you don't go play ball, you don't get cacked to. You they hide them, not so. But when you hide them, the more that cacked to they smell. Now the more they cook inside the sauce, now the more oxygen deprivation they take place, they heal. So the only way whether they heal in medical term they call it debridement. Now we can go, then crepe that wound, fresh wound cam, fresh blood became candy. So most of them, what they kill them actually, now 2 things. One, withdrawal syndrome, now they kill them. What's the withdrawal syndrome? Because their body don't become so addictive for them, cravings are high. What they want for lefer, then body not able to allow them for lefer. You get what I mean? So what's gonna happen? The heart begin beat fast. Then they torment. The heart rate is high, and then they get into shock. If somebody know they near, they wouldn't get into then shocks and then they die straight.
But now the Kush kill them.
Yes, na Kush. Yes, na Kush related, right? But you know they. So this is my argument. I know where you're driving to. This is my argument. You cannot just say, because then sauce in the back, people then they will get diabetic, where they get them sauce in the diabetic sauce them.
Forget about diabetes, Mike.
Yeah.
When they talk about death there now, where you now one of free people, all the questions say not to Kush they kill them.
No, I not question say not to Kush they kill them. I take that back. I just say, my question will say,
based on what you don't explain, it clearly shows say because the Kush when they take, then at the system, now one of the causes of death.
I totally agree. Kush they kill them. But what my argument is, I know where you're coming to. The mayor in claims we make of 220 bodies. My argument is, if the question usually prove a data.
We no go one forget a case outside the mayor will call for response. You know, they are now. Lord just discuss some of these issues because they look at the clinical perspective, being that you get a medical background. Lord discuss some of their issues, then we don't hear the figures. Be quite alarming. Even cities in them don't join the call now. You just see the pictures where they viral. The council be don't come in, but issues come between them and local governments of question of data. The mayor don't provide in data or don't deal with that.
No, we'll not deal with that. Because if we are discussing this as a national issue, because the argument from yesterday to today, you'll find out, say, Khadija, these are the questions when some people keep questioning me. The point I will raise with always I don't explain so. You know, they see somebody lay down a gun, then you say, just because you say he die, you see so foot in body, then you say na Kush killer. That is my argument. The only way we able know say na Kush kill that person there, now we perform what they call a toxicology. So this is my problem. Waiting the mayor do a good thing for pick body in the street. But my problem where I get with and the reason why people they question all the data they are right now where they pull, are because if you be doing with collaboration. Let's say if you be involved Ministry of Health, then gets the burial team the way they collect, we trained, we know, we Ebola cam, we I call them COVID cam.
Are they doing it?
They are. They are doing that. Then they. Now collaboration they need. If you decide, say, okay, you want for one, you call ministry, you call ONS. Khadija Law understand, say, this Kush fet is multifaceted. Not to one approach, not to arrest no more. Social welfare get hand inside this. This is a national security where ONSF get hands inside this. You get Toko, where they are the police unit where get hands inside it. You get a lot of agencies, inter-agencies, and where they collaborate, even Ministry of Health.
So the reason why I ask, way before the mayor in council they begin get at them body here. People be done they complain at the social media, can even snap them, put them. Then can call because then they feel say now the council supposed for pick them body then they'll become then they in charge of the city per se. We never see outside Ministry of Health or all them body then we don't call. Come out can tell the public say then don't begin pick body then as street until council after the persistent calls where then be done they make council begin pick the body then.
Well, that's why I say council for collaborate better. Because the question is now, if you do good now, you do good back after question. Because listen, the reason why people in the question is let people understand, say this is epidemiology. It is not based on then they really, it's not based on like say would they try for question whether I lie the mayor they lie now this out of social media banter all them jokes and the thing and they will come in. But the point here is if the epidemiology of the deaths them, the mortalities them, the people that we don't pick now, we need that for making informed decisions and with interventions. How? We want to know who say more than people they already die. We want to know who than them people that already die, the age brackets. We would love to know what thing kill them. We would also love to know if them people that already die now more of woman, now more of man them, now morning then they die, now even tell you they pick all that in public health is called epidemiology. You need that for make an informed decision. And in doing that, that has to be accurate. It has to be solid. So if you no more grab, you not get Ministry of Health involved, you not get social welfare involved, you not get the police involved, you not get NDLA involved. There's not only one structures. All the structures, you not get them involved. You say they call them, you this, that, you call chief minister for elevator, you write a letter, where's the official letter where you write, say, you call all them people there.
Mike, you don't think say on a focus now as a government for be on the crisis or this particular epidemic where the country they battle with now, how for put under control, how for cut the supply chain, how for get hold of them people how they manufacture this particular substance, rather than going back and forth as to whether you for consult, whether you for work with.
I totally agree. And that is why I'm here also as Director of Communications for tell you what's on the plans same way we don't make. Yeah, on this. What's on the interventions the more don't make. And what's in the dilutes the conversations, Khadija, is when all the interventions they all don't do as a government and as a country, what's in President Bill don't do. Then if you come sit down already there, you talk, say presidents not do nothing, this government not do nothing about it. Then we on as spokespersons or communicators of the government will take that personal. We'll have to comment and you say, no, that's true.
The Minister of Information where we host here day before yesterday, we say as a sitting minister, he confessed that the government not don't do much on this issue of Kush.
Yeah, we keep doing. We are not there. Khadija, anytime I come here, they tell you, say, Salon, we still have to do more. Khadija, you still have things that are killing people in this country. Malaria is the highest killer of infants.
So why you disagree with the people where they say the facts say government not do more?
Would I don't disagree with people?
You just talk na just not say now that's make people in Canada studio they say government not do. Una not can take
government
likely.
not do nothing yet. There are people who say government not do nothing. I agree, say government need to do more in every sector.
2 years.
In every sector. Yeah.
If government be they do something, this country don't they battle this epidemic for 2 years. With all the measures them where you say through the presidency, una don't put in place, but still people in the important kind of this country, still according to you, then they manufacture and labs then they exist. We don't they see videos, even the law enforcement agency, the police were supposed to go after them people there. Then say them video, then they out, then they take the same substance. And as it is now, it just stand like everything don't scatter the government hand.
Khadija, that's why it's a societal problem. Khadija, every country they battle with that.
But
countries
you say una not be ever taken serious.
No,
because if una been taken serious,
Khadija,
2 years now,
Khadija.
no appropriate measures they not there yet for put the supply chain under control.
Okay, give me just 2 minutes later. You the measures they will take. Well, very robust measures. First of all, from 2023 to 2025, the first president do declare a state of emergency. I am coming. I just
emergency.
Yeah, just I am coming.
Everybody
when you say not treat
knows committees then don't day where they don't set up.
Yes, so
but 2 years then
so
committee they don't work. Where they report, what they investigate,
okay,
who them
so that's
to
why
book.
I want to. That's why I'm coming. Just allow me make a land. I'm coming because these are the narratives and this will not want let people push. If we have to fight Kush, we have to fight drug. Like every other country, all of us have to come, apolitical. We come and sit down and fight it because mothers are affected, children are affected, schools are affected, we all friends are affected, everybody. But when you come and say government not do nothing yet, for let government declare a state of emergency, there is no seriousness where reach down the for let they say we're not in a state of emergency in a country. When they declare say this is state of emergency, we have an epidemic, a national epidemic. That they tell you say you they heighten everybody in the country for tell you say this. After that, the vice president gets a stakeholders meeting at Buntimani, where they call everybody, civil society, paramount chiefs, the journalists, them, party executive, everybody, lawmakers, everybody. After that, then form a task force. Khadija, when you first Kush, Kush is not only about arrests. It's not. Any sudden effect drug, not only arrest, it takes psychosocial. It takes care. Treatment and care. Them people that way they see so, you get for care for them. If you say government not do that yet, you know how many people them they where government don't treat for Kush? Now the one that when able get access to the care. Now that you see what the dynasty.
Mike, you aware say, Mike, you aware say with all them thing there we don't outline say na government measures. You aware say even rehabilitation center there. Now then they are they open too.
Okay, yes, because at the end of the day, governments have to face constraints. Money no day. It's constraint. Nobody know they can. Khadija, we have women who are still dying of cancer a lot in this country. Breast cancer, cervical cancer. We don't have good MRI machines in hospitals. Then they come on how they go Ghana. So governments are getting health priorities and they look at data.
Money no day. What do you mean? Na money no day or na the priority government no put right?
So
because
if they talk about
you they say money no day, but every now and then sitting in the sea President Bio, they fly every 2 days.
So this is not the argument. If President Bio not go fly, how President Bio will bring MRI machines in this country?
But the people then they die Vietnam.
Khadija, we talk about when you talk about priority.
People are dying, Mike.
Okay, when you talk about priority.
President Bio they see the amount of dead body they way they lay on a street every now and then.
So when you talk about priorities in healthcare interventions, it's informed with data. Yeah, I don't want to be insensitive to say this, but in healthcare, it's informed by data. If you take a look at the data. Kush not to the highest killer of Sierra-Leoneans in this
but
country.
you see
government data. So this is Adikam. This is what I'm saying. Let me tell you, say it's not the highest where they kill people in a salon.
Not to the highest.
No. Now you talk say you talk about priorities.
No.
Now we not talk about priorities. Me number one go there. Now you talk about government priorities. If government they allocate resources, if government they allocate healthcare resources, they therefore look at the one who said they need them more. So this is what I'm saying. Say, when you look at malaria, upper respiratory tract infections, diarrhea, non-communicable diseases, tuberculosis, HIV, they kill people the more past Kush. This is a fact. So this is so Adikam. We'll done this. Don't take my thoughts off. And they kill and at the data they give so. Like where you go ministry website. I look at this morning before they come. You look at the first mortality, second mortality, third mortality. Kush not even did it first. Right? So what do you mean they try for tell you say? And they also try for tell you say, if you look on a journalist, if you check, more people than we don't recover from Kush. More. We don't go through.
Recover where rehabilitation center.
But only one rehabilitation center will get at this country.
So
you don't
how
go
they recover
so,
when the rehab center?
Now one rehab. Now what he was rehab?
The last time
we all really concerned at this.
Okay, so this is the thing you don't understand. A rehabilitation center is not a treatment center. When they get this thing, when I say when journalists alone, when they do some research, a rehabilitation, na psychosocial support that, not a treatment center. You get treatment centers that when they give them people their medicines and they recover. I don't tell you say. I don't tell you say Kisi. I just mentioned one. I tell you say Kisi mental home. Now a whole hospital when I over 500 beds hospital where just they na for them conditions there.
So now they then Kush.
You get for allow me. You get for allow me. Make a land.
But we're having a conversation.
Yeah. But allow me make a premise. Then we have so we'll get Kisi like how you get. Hospitals them for Bele woman, you get hospitals them for Pikine, you get hospitals them for certain conditions. The Kisi Mental Home, which is one of the biggest mental hospitals in Africa and West Africa, is functional very well. Them patients they added it. You not go see the one where they go through there. It's difficult. The challenge when they get is we get more cases them where we not get beds them for the hospital. So you get, but it not means the government not they do nothing. The patients them will get Kush, then just left the normal the pass na treat. You have more people who are recovering from this condition.
Now that make I ask now. From government data, how many people don't recover inside the past 2 years? How many people don't die inside the past 2 years from government data?
That is a lot of data I have to
collect. You say the number no.
So no, they tell you say.
And not boku. Yes. You know they kill people like how others sick they kill people.
Yes. So
for
because
clarity,
if they kill people,
because if you know say, you know they kill people like how others sick and they kill people. It means you have the data where una don't see. Based on own statistics, one I don't gather. Inside the past 2 years, almost people, government knows they don't die of Kush, almost people don't recover.
So, when they populate health data, sometimes they do out graphs. So sometimes if you go to the website, they will tell you that top 10 diseases, mortalities in Sierra Leone. Then they put the diseases. Then go put like malaria, then put tuberculosis, then go put this. That for just pictorial thing. So what me they tell you now, I know where I can tell you say from so that data I get for collect. I know we can't tell people, give people false information. That data that's what I get for collect. But what me they tell you say, I just want to let you know say, we get an hospital where they admit, we get 6 psychiatrists in this country. We very smart young people where they work. We get hospitals there. We get even the I call it the regional hospitals, Khadija. Now I make up one law with like align with what we don't do as government. But no one give me chance for that. Tell now. WHO and Ministry of Health, then the partner, there's huge partner, where they don't open detox centers, them, now hospitals, then get units in there. Khadija, like when you say a hospital gets pediatric units, it gets surgery units, it gets medical units, it gets units for Bele woman, it gets units and back for them cases then they. So yes, they're not going to be boku. Sometimes, let me say it's not Kotloko, something at 20 or 10 beds. The cases then boku past that. So, but with all this, that is why governments need to mobilize resources. Huge fund. This is a very expensive thing for do. This not a thing number way because at the end of the day,
Mike, you go authoritatively tell the public this morning, say the Kisi Mental Home government.
It's functional. No go
I know
far.
they say not functional. Can I please ask my question?
Yeah.
Governments don't turn into a treatment center for Kush.
You're not asking kind questions in there. Kisi Mental Home is a treatment center.
Well, the public
So-
no be
so-
know
so-
na until
no,
we talk
you don't know
until
that
they
the
say
public know,
na
because-
a treatment
no,
center
no.
for Kush because we don't hear medical
Khadija,
people them don't they come out
Khadija.
then they complain say as it is now they don't even get centers them rehabilitation center for the people
Khadija, now
there.
make
So
Ipona-
if you are here, confirm and now let all man know say
Okay, listen now.
government don't turn this place to a treatment center for people that when Kush addicts.
So listen, the word rehabilitation, a simple English word where I know say you are a smart woman, you know what that mean. Rehabilitation is not treatment. There's a difference between a treatment and a management. Now I make way look at President Bio in 5-step strategy. It make mention say first prevention, when awareness raising, campaign, talk to people, stakeholders engagement. After that, it comes to treatment and care. When at level 2, then a treatment, and they give the medicines, and they detox them, when they say flush them, pull them inside them system. Then after that, you come to rehabilitation.
So now
No, stop me. Where I land? Then you ask question, Khadija. Where I land? You say let come, let share me inside. So allow me make I do more of the talking. Make a land. After that, you come to rehabilitation. The rehabilitation now, Khadija, now more of psychosocial. Now you get counselors there. Now you ask you question, why make you take this? Why make you do this? Then after that rehabilitation they back. Now make you find out the rehabilitation. Now social welfare, not under Ministry of Health today. Now that social welfare idea. Now more of counseling. So at the camp, after that rehabilitation day, then you integrate them into society. You get for even provide housing for them. You get for provide skills for them. Because if not to that, guess what? When they get bad, then they relapse and come back into society.
At this stage, anybody where they listen you, we know people and we don't take the drugs, or then self something and they listen you, let them go na Kisi mental home, then go get treatment.
So there is a process. Just listen, I just explained to Nayasi, but this was the question.
No, because if you begin to
when you say mental, I want to understand. Say,
Mike, if person sick, there's no process for let go hospital.
No, because
if you don't say Kisi mental home, then they take care of them.
Okay, so listen to what I tell you.
Then can go. So outside them for go.
So listen,
where then they listen.
So listen that to you.
Outside for go.
You can come now. There is still
Kiama Road.
You know they understand what I say. You can still come here.
Where?
Allow me make. I'm making a premise. You can still come Kiama Road. You sick, you get malaria, you come. They not admit you because bed no day. I just explained to you people, so Allah understand for see, this whole thing where they happen, so na mental health. This whole thing where they happen, na sickness, na mental health. So, Kush drug addiction is mental health. And that is why the people they want the master sabi people them, the hospital where they for that na Kisi mental home. I just explained to her, say, it's full. Majority of the patients when they advise then get other patients when they get schizophrenia, when get psychosis, when not even Kush related. When a craze no more. But Khadija, majority of the patients when admit at Kisi mental home today, na Kush related patients.
So anybody who suffer from any side effects of Kush or Komon, then now they call on government for help them for them picking them. If then go na the Kisi mental home, then able to get
this is the thing about Una. Una always try for put Una always try for do got you questions. I don't explain this countless times. I don't know how I want to explain up a Monday. I don't explain to you say. I don't explain to you say the hospital is full. There are no beds. Because the patients in Bokude, patients and they go there, then they die, Bokude there, then they detox, when they come back, we come into society. That is why I remember one time where the social welfare guy, I don't know if now a hoster of Lamran a hoster, it tell you so they still have people on the waiting list. A waiting list. So there is a process. Then get a call line, then get a process where you call, where you go, and then they get you in there. Because of a fool. Now, this are the try for explain to you. Kisi mental home, now the only hospital, now they go admit somebody in a Kisi mental home if you get malaria. The only people that wouldn't admit are people them will get conditions like them conditions. They are Kush now a mental condition. Anybody with in mind sane, with in mind steady, in order to take down a mental illness.
So waiting government they do, we don't realize say. The Kisi mental home, for example, so you say treatments they happen, full. Waiting on they do for the one that way they out. Because most of them they out and where they die.
That is why I'm here today. So government they open more centers. They don't open centers na Dau. As I tell you so, they don't open centers na Hastings. As I tell you so, then they try for intensify. Yesterday they had a cabinet meeting. Then they try for intensify, mobilize more funds them and see how they can get in the hospitals. Remember the same strategy we use for COVID, right? Ideally, COVID, Khadija, you know, for even mix out other patients them. Somebody will get COVID. But then take them and care them go to their hospitals them. 34 we get a unit where they take care of COVID patients, Ebola patients, cannot be get the own other hospitals then we get the own them. So that same method in the government they try for revamp. Khadija, this is an expensive activity. It's expensive. Then people there, you go say if you give them medicine, then well back. If you not integrate them into society, if you not give skills training for them, if you not provide something for them, they are going to also relapse back because they go back into the same society.
Mike, President Bio many times they talk about human capital development. They talk about how a president will believe in the young people.
He do.
And with all what's in the gone currently, President Bio really concerned?
Pass mark. If you not be concerned enough for establish a task force, if you not be concerned enough for declare a state of emergency.
2 years we do on this state of emergency.
So yes.
Waiting are some of the benefits them where the state of emergency don't yield.
Okay, these benefits of the state of emergency, I explain to you that, not interrupt me. The reason why they establish a state of emergency, besides even raising awareness for let people them all be heightened and know say this is serious. One, state of emergency, they give powers to the president. You don't get to tell me. When it comes to that for doing anything. Like I tell you, say we lost them when it comes to mental health. We lost them when it comes to illicit drug, especially like synthetic drugs. We not be get them inside, we lost them. What be they talk about? When you look at the Lunacy Act, you take a look at the Mental Health Act. Now Jamba no more be the focus on. Khadija, I want you understand, say this same awareness here, this same thing here, be happen in the time of Pampas water can in this country. Pampas camo. That's how we all get crazy. We all go on radio. We all try to raise awareness. But we ain't going to stop Pampas line on can in this country because people didn't use Pampas water. So the regulations, they're all now coordination. Waiting good, but this state of emergency, what this state of emergency don't do, it help units them where you will help for support this epidemic again in this country for letting coordinate more. I agree. Now I say much has not been done because probably budget constraint, because probably resources constraint. But it don't mean say President Bio no care. It don't mean say no care. He's a ceremonial head of this country with all the mobilizations where they do for raise funds.
The question I ask you, Mike. The state of emergency, the task force, and the other things that we President Bio put as a response mechanism. 2 years down the line, what do you go point at saying that it benefits them where this particular response mechanism do yield? That's the question.
I just tell you, say, we get more people than where they recover from Kush past the one where they die.
Waiting now you did statistics.
Well, that's what I tell you.
How many people?
Because you get people that where they admit, you get a lot of people that where they admit the challenges. Most people within at this street, I want to let you understand something here. Kush is not even Kush is not only affecting people in the streets. It's affecting homes.
Mike.
People, no, listen, it's affecting homes. What thing I tell you, so now two I tell you. Say you get people them where they go, where they admit. Families them, where get sababu, where get connections, where know the procedures for follow, where they admit. I just explain, you know what? This is the thing. We all fixated. We don't want to have a genuine conversation on this. We don't. Nobody know they deny now. Say we not get a crisis. There is a crisis. More people are dying. I agree with that.
Mike,
That is not what I'm arguing.
you said it benefits.
But the point for me to say.
No, Mike, you said it benefits of all the response mechanism.
I will tell you now. I say more people than they we don't recover. Governments don't treat more people we don't recover.
How many?
More people don't they we don't recover from Kush than people that we don't die from Kush.
How many people?
How many?
I will not give you a definitive data here. No, listen.
How
You know.
inform the public?
No,
say
listen.
More people don't recover.
Yes.
Than the one that we don't die, but you not get data for sure.
Because if let me say, I just explained to you here. Say, when you look at mortality figures, when you go at the health management data, you look at mortality figures, they give you the one that one of the highest rate of death day. And they tell you saying that malaria are the highest rate of death. After that, you get non-communicable diseases, you get tuberculosis, you get that. So that don't tell you say
the fact say you not get data for show the public. Because if you are making an argument, say more people don't survive past the one that we don't die, show people the data. That's and then gonna say from government's own statistics, this number of people don't survive compared to this one that we don't die.
This is the problem, Utuna. You like this is why I say sometimes you guys don't want to have the problem is you don't want the problem is you don't want to have a candid conversation. You understand? You want me to come sit here and say, everybody where they take Kush don't die.
No,
but that's what you say.
We
because
ask
you know,
for data.
If you believe me perspective, I don't explain to you now.
But you can't force people for believing perspective when you don't get proof.
No,
you don't get data for sure as proof. How for believing perspective?
But you believe when the I call them the mayor said 220 people died are all Kush related, right?
Full data.
Not that data, Dandy. Is that Kush
so
related?
So waiting a government's data.
No, like,
so Mike, waiting a government's data.
Is that all them people that they will die? Now Kush related kill them. Is there any scientific data?
You don't think say all these arguments for don't come to a rest if government we don't pull on your official data, they challenge that of waiting the mayor they say.
If government we don't pull on official data, the data there. If you need the data, listen. If you need the data, you're gonna how you call them, Ministry of Health, or you're gonna what's a mental home day in Akisi. For them to go give the data. My thing I'm raising is this.
So why are you coming here? You did talk on behalf of the presidency, Mike. You declare you know able to provide the data for people. And then you say one of the benefits them where presidents and government response mechanism, one of the benefit the way they heal, more people don't recover from the hospital. So I believe say you as a medical person don't practice now improved country like the United States. Anybody they discharge and they get record of them. And governments they fight a crisis now. I believe say during the time of COVID, Mpox, on have been set up a situation room outside the numbers and they come. Every evening the Minister of Health they provide the data of how many people don't get infected, how many people don't recover, how many people then at treatment center. So why this push where you say the response and more people don't recover, you're able to provide data from government?
So the COVID response is different from this. I just explained to you, say, this is the make I say sometimes when I get conversations, when I just look for some gotcha questions. The COVID response, I will sit here and tell you that, yes, more children are dying of malaria. I go to tell you say more children they die of malaria authoritatively, but I'm not gonna tell you say now 50,000 people don't die of malaria. I will tell you say more children die of malaria in this country. I go tell you say more people they die of HIV/AIDS. I'm not gonna tell you say so people don't die of HIV/AIDS, like because one, most of them data and the people themselves where they die in the streets, it can possible say it's higher, it's possible say it's less because you don't know the ones who die in hospital, who die in homes. So what me they try for tell you say there is a structure. The structure now the Kisi psychiatric home. In that structure we have people who care for people with conditions like that. In that structure I also know say more people than they when they admit they beds no they, but more people than they are no say more people than they where they commodity. More people than they where they commodity. More people than they where they recover from that. More people than they where they get relapse back, where they get that condition they then go back there. If you say, let me get a data before I come now, I'll get a data of all how many people that don't admit me, how many people will take Kush, how many people. I'll be so glad the next time if I come here, I bring that data there for you. But I believe say if I bring that back, you go. I go surprise you. You ask me back, say what's in the data of the people them, how many acetone they can at this country. That shouldn't be the conversation, right? That shouldn't be the conversation. So if I tell you more people are recovering from Kush, that is true.
What's the inform that you statements there?
Because when you look at you get what we call mortalities and morbidities. When you look at how many people they admit and how many people they recover from them. The one where they go to hospital, where they go into institutionalized systems, they recover from that. They not they die from it. They want them. So this question all with all the time where I don't come now the conversation the end.
But what's in wrong,
right?
If you
no. It's a conversation. This is the problem with you people, Khadija and
What is the problem?
So it is because the conversation. I will tell you now. I say, Sierra Leone will not reduce maternal mortality. No. It's my argument.
Mike,
it's a premise I am making.
Mike,
no. You not can't tell me say. You not tell me say. Listen, I'm not a superhuman.
Mike,
you never tell the try for talk. I'm not a superhuman. It's because of the perspectives make when I come in and I say make I can sit down, look, talk. I expect us as mothers. Let's have a candid conversation about what is going on. You can be a journalist and try for say government is not doing nothing about Kush. I will take that to exception. President Bio is not doing nothing about Kush. I will take that to exception. That is what the argument. That is the argument pushing. So
you just asking for government data.
So listen.
And
I am coming. I just explained to you, Nayasi. I explained to you here. I give you a deductive data. See, I'm not here to give you numbers. I tell you now, I say the first 10 killer diseases of Sierra Leoneans is not Kush. What again you need from that? If that you want to argue me, we can pull it up, we can look it up here. I just explained to you, say that a London inform what I tell you so. Say the first 10 diseases where they killed Sierra Leoneans them as of today, 2025, not a Kush.
Michael, move forward with the conversation until a later date so you go get access to data where you go help we with, who go gladly publish then data then they let the public know the number of recovery.
If you say Sakia, for no listen, if una say Sakia, this way don't can talk now. I say people don't. So this is a thing.
It's okay.
No. Wait. This is a thing. When I say get a role for play, you don't. So your role is not just to babysit. You can prove me wrong.
Kush issues
So how you
been here talking about
how
it,
you can
been
prove
calling people.
No, how you can
talking
prove me
about
wrong? No,
it.
you don't just sit
don't
down.
Go down that line.
No,
please,
you don't
Mike.
just sit down.
Let me move forward with the conversation.
Okay, what's it want to do?
You not a dictator. What you want to do or not? Let me move forward with the conversation.
This is a national something.
Whenever the data day, we go publish the data.
So you go and look for the data.
We they publish the data whenever we get access to the data.
Say, Mike can talk now. Say there are more recoveries on Kush patients where they admit at psychiatric hospital, mental psychiatric hospital like Kisi, than the one where they die.
Mike.
So you go and prove me wrong. Go and prove me wrong. You don't allow me to do all the things for you. I babysit you. Go and be a journalist, fact find. After all, somebody can wait, don't talk now. When I've also go fact find. When I put them out.
Move forward with the conversation.
Okay. All right.
In all of these issues where they happen now, this crisis where the country they go through, as somebody from the presidency, you want for say government they on top of the situation?
Yes, government get challenges.
How
so I hope you allow me make outline that. Waiting government they do. I just tell you say government. These are the things that government don't do. I explain to you say the way we fight this, and we are not just fighting it because just arrests. Government's president don't declare a state of emergency. President don't set up a task force. With that task force, they will gonna expect people the way they look into waiting for do. Then they look at the data. Government don't provide a 5-plan strategy where every country where they find drug addiction. America, they suffer from fentanyl problem. Brazil, they suffer, they get them, every country. That 5-part strategy government don't put down, 9 and they work with. Government, the vice president also gets a national stakeholder. This thing here, nothing will affect with schools. We necessarily get involved. We get parliament chief them, civil society. That's how we fight. Governments don't team up with WHO for establish what? Detox centers them across hospitals. There is a funding going on for that. Government, one of the things that will come to law enforcement, recently you see how they don't allocate 7 magistrates, then they don't get a special cut for them conditions. There are people them where they sell, people them where they produce in this country, now they don't get a special cut. 7 magistrates have been assigned in Western area and across the country for deal and expediting cases. Then waiting again and they look at the laws and for reform. That is what government do. I don't understand what you mean by government if now president be over go to street, be arrest people them. That is what government do. Government set the policies. Government help in coordination. It is up to all of us. Even when Ebola come and a plan. It starts with plan and implementation. It's all about that. You not go just say, now government one way for do this. The question where I want also long when I say they ask certain people the way they come now and this on a panel is this. The people them where they come, have we ever seen anything from a press release, maybe from the opposition party? What are they doing? Because they get representatives in a parliament. From the law perspective, what are they doing? How are they engaging?
Mike, with all of them thing there, so what you don't talk about. For declare state of emergency now one. For set up task force now one. For put policies in place now one.
For raise fund, for mobilize money.
Now one. But one thing we establish for let everybody get a clear picture. Now the result of all the mechanism there we
it has to take time. Now I can tell you say it's a long recovery.
2 years.
It's America not 10 than the 2
many good years.
So if you say
with all of their mechanism
if you say they ever done
with all of their mechanism there,
and not ever
now
done.
more of cry, public outcry, they out there.
I totally get that. I totally understand that, and I felt Khadija, I know they can't do selective sympathy here. Everybody in this country, everybody is affected by the Kush. I know we can't tell you who then would have affected, like how everybody they can forget sympathy. Yeah, I come straight. What me they tell you say is this is a long-term recovery. It's a long journey. It's expensive, it's extensive, Khadija. It's a long journey. Also, something more people that they Allah done. It not get for even ever done. The government not get forever done at this country. It will alleviate her.
When they try for fix a problem, if you don't put one solution, two solution, 2 years, you know, work. You know, things in attend this for let government go back na the drawing board and re-strategize.
And that's what government is doing. That's
so
why I just
the new strategies.
I just tell you now, yesterday they had a cabinet meeting.
Waiting commodity.
Well, the thing that they explained to you. But it's like I don't know if like you already fixated when you're asking questions.
You can say anything.
No, because the thing is because you don't want to listen to me. You don't want to you call me, you don't want to listen. I just tell you say government get a what? Government had a cabinet meeting yesterday.
So
if you're not journalist, no, but what's in commodity? Just like nothing, like you giving an attitude. Government get a meeting yesterday, cabinet meeting yesterday. The cabinet meeting, I just tell you now, say they don't revamp resources. Every week, then they allocate resources. Now they don't activate all government hospitals them for let them get detox centers in there. They don't activate all chiefdom levels, district levels, social structures in there. President Bio is going to have a national dialogue also on this. We go call stakeholders all over this country. Now this you need for make like I explain to people. Not so for that you can't ask me how many patients and they admit na Christian, what's in their name, what's in their sex, how many don't recover. If I come and tell you now, I say more people people don't recover from Kush than they die. If more people don't die faster than they recover, and then the mortality figures, then the populator, now the health data. Say more people look when HIV more people they kill HIV, so then they put on this and the third highest thing when they kill people in a salon. So now that data there they tell you want that give figures say now 860 people. Not call people them for embarrassment.
You don't talk about Mike.
Nobody don't call you for embarrass you.
Don't do that.
Nobody don't call you for embarrass you.
That's what it look like.
You know
when they talk about issues, you say let me give you data. Question the thing that they want to ask you. If I ask you, if I ask you, I say
talk for the presidency, Mike.
If I ask you,
come to public,
okay, no.
On top of
I am on top
you
of.
for expect any question for come.
Yeah, but I have
you
to
for
be.
respond
No,
to
but
that. You are here to communicate.
No, I have to be candid also.
Nobody not call you for embarrass you.
No, if
we
I
take exception to that.
No, if I ask
nobody not call you for embarrass.
No, that's what it looks like.
You're not there to ask quick question. We are here to ask you question, then you answer. You inform the public.
No, I'm not here for.
Let's have a civil conversation.
No, I'm not here for an interview. I'm not here for I'm here for a dialogue. I'm not here for an interview. I'm not a job I come for. For an interview. I need for ask you. If I sit down and ask you, say Khadija. If I sit down and ask you, say name for me all government officials there. How many government officials there from 2020? 5-1 are open this station now. We don't can you able to pull out data right now?
Mike, so the latest information we don't give the public.
So don't focus on the issue. No, I'm vexed because it's like you want to embarrass.
I'm not.
We've gone past the issue of the data long ago. We remove the conversation forward. You don't give the updates yesterday we come out from the cabinet meeting. So the detox centers, the more you say, then they reactivate. Government pass based on that meeting with the whole yesterday.
Right.
It take effect when?
Well, that has to be on the planning. It's in the preliminary. It has to be planning. But this is not government's new approach to this whole thing. That tells you the government is taking this very, 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 very seriously.
So how then go for work?
How the detox centers then they establish them. Now how you call them? Now hospitals and regional hospitals. You get trained people, then we get for the day, then get for train nurse system in that thing. Where you get, if not like McKinney, then get the, then take it and then detox there, then rehabilitate, and then probably we'll get rehabilitation centers then. Because when they come up from the treatment centers, then they send in a rehabilitation centers. Now they rehabilitate them, then give them psychosocial support. Now then they come out. Then they integrate them back into society. Because
the reason why I ask when, time is very essential in all of this. As we talk now, you go bottom bridge them, you're gonna start in communities, you see a lot of young people where they into this drug actively and then they die on a daily. So time is essential in all of this. Any time frame the way government the project say, this time, then center for don't kickstart them.
I just tell you, say this now a decision the president take yesterday, na cabinet. Planning is on. It has to start with structures. It has to start with planning. But one thing also I wonder we understand here. I feel say also maybe sometimes maybe we are exaggerating this thing too much.
At the height of which
I really feel say
exaggeration.
yes, I feel say we are exaggerating it a lot. We have a crisis. That is why it's an epidemic. That is why a state of emergency was declared. You get what I mean? But now we know they talk now like say, oh, people then they die every day and government is not doing nothing about it. I also take exception to that. It's unfair to us as a government. It's unfair to us. It's unfair to President Bio. It's unfair to the people who are working, who are sitting, who are thinking, who are putting policies in place.
Essential.
We know that. We know that, Mabel. You think we don't know that? Yesterday cabinet meeting, that was a discussion. You think we don't have challenges in this country?
Why you say it unfair to president?
It's unfair because
it gets a responsibility as a president for protect the people, the lives, especially young people, where you say bring human capital development for. So if there is a crisis, everybody they expect us as a president if we put the appropriate measures in place for deal with the crisis.
Yes, but when in appropriate measures, if we put in place and if it's not recognized by people who are supposed to recognize it, people like you who are supposed to get a fact finding and talk about, say, yes, the president don't do more. We just try to look at, oh, he's not done nothing, government not do nothing yet, government not do nothing yet, this, that. Then it dilutes the
people
conversation.
People don't need for recognized President Bio.
No, they do. If you criticize somebody.
President Bio, the mechanism, the way he puts, he work for deal with the crisis. Now the people in back, they come and talk and say, yes, we will deal with the crisis, but now government are able to put under control. Where if they deal with COVID, if they deal with Mpox, everybody see the measures them. It put right measures, everybody join them. Well, body will command them join them. It work able for put under control. So not all people need for come out and clap say yes, president don't put measures them. Where the measures then work, everybody go no say they work.
When a long term, like I explained to you, say it's
a crisis, not a long term measures so, put, Mike.
I tell you, said a long term measures he put.
But you said
I said a long term.
You said it's a journey.
You talk about you.
Earlier you say it is a journey. Khadija, now you say it is a long time.
Khadija, I tell you, say President Bio put measures in place. The recovery, you talk about impact. I said the impact is long term. I don't take my time, I don't explain you say mental health, psychosocial recovery, it takes time. Khadija, we not get for done drug in this country. It not get for done. No country no they don't wipe drug with drug no deal. Let's have that let's be real. Let's be genuine. Let's be authentic in our conversation. It not get for done. Now elevate to the elevator. Now your pampas wataka make a loss. Other one come back. Cocaine don't can it don't lost. Jamba don't can it don't lost. Drug thing it go always day. It go always day. So let's don't put it like government don't neglect government. See down people that they die in our street every day. People no. That is what I take exception to. We as a government, President Bio, who I speak for, has done this. I will tell you this. When President Bio win elections, when I visited President Bio for the very first time for congratulating him and get conversations, that was one of the things that we'll talk about. I looked into his eyes. I know how passionate he is about young people in this country. President Bio don't exhibit how he care about young people, how he pay school fees for them, how he don't bring them in governance, how he don't promote them, how he don't empower them individually. We don't see in this country because he believes say the young people are the majority, and the majority in democracy, the majority are for lead. So if you see them, if you talk about, if you
feel this way,
no, well, I come.
If you feel, Mike, if President Bio they feel this way for the young people, them as you just describe them, is he worried now? Then same young people that they every day.
But I'm going to tell you asking this question. I told you.
Is he worried that every day
if President Bio not worried, he not go pass.
Streets?
If President Bio not worried, he not go pass state of emergency. I don't know. Sometimes you overlook state of emergency. Eh? You know what that they mean in our country?
Solution. This is a crisis.
So
the public they look forward to a solution.
So you think it's a quick solution to this?
Nobody knows just one for every now and then. We don't put public emergency. We don't put task force. Then they investigate. Where are the reports?
So you think this is a quick fix?
It is not a quick fix.
So why are you in a haste?
Measures. I'm not in a haste.
You are.
I'm not. Now the public and comrade the way they cry out every day for them
Khadija,
picking them. Now then they in a haste.
We self get picking them. We self get comrade them. I know everybody's crying for haste. What thing I want, let me hear you sit down, they talk about here, where I come like panel, where I come like you show me, you sit down put. So let's look at the measures of President Bio don't put in place.
Now, you know,
and
I don't get a civil conversation.
That's not what,
we hosted the Minister of Information here.
Yeah.
We had a very civil and peaceful conversation.
He's different from me.
He stated the facts.
No, he's different from me.
And you now, a whole director,
so he's different.
We come up from the presidency. So anything come up from you, not from President Bio.
Thank you. So he's different from me. So I don't want you, first of all, take that back. Don't compare me and don't compare me and any person. I'm Mike. I'm unique. My uniqueness, just like Aina Khadija, unique. Not compare me and Minister of Information. Not make this thing personal.
Other people then when they get a very civil conversation, everybody they understand, then they send them message them clearly rather than feel like say we want to embarrass you. That's your words.
Let me ask you a question. Khadija, what's your goal?
You're not there for ask me questions.
Of course, I'm not care for interview. I care for get a conversation.
Back to the Kush.
I come here for get a conversation. I'm not care for let you interview me. I come here, I'm not a job I come for. I am trying to be very respectful because you're a woman, me, you get a friendly relationship. But I'm not coming here for let you can put me on the spot. I'm coming here for let we get a conversation. Let's have a candid conversation because this is a national issue.
So, Mike,
if you are failing to recognize what President Bio has done, you're failing to recognize what our government has done, then you they say, I don't sit down, I don't explain. Please, Miss Mabel, make her just learn, man. Make her just learn, man, please. I don't take time, I don't explain to you, say, this is a long-term recovery. I don't tell you, say, it's extensive, it's expensive. Our healthcare system is donor-driven. Money no day. Beaucoup challenges and them in healthcare. Beaucoup, if you say let government not allocate funds them to cervical cancer, let government not allocate for picking and they die. Let government not allocate for buy oxygen, for buy medicine for picking. A lot of focus on Kush. Now you talk about priorities. And when I come and tell you, say, when you look at priorities, you look at the data, Kush is not part of one of, among the 10 killer diseases of Sierra Leoneans.
Right, so
then you say, make a give figure of.
Moving forward, don't leave that data. You be don't say we left that data. We don't move come up from
not
the data. So let's come back now. Let we come back now to the conversation of because you refer we say we go na kisi mental home, which we go do and go. And if you been give we for don't go fact check.
If I ask you now, how many ministers are you doing interview? You can pull that off right away.
Let's just move forward back to the issue of the number of young people and we still take the Kush.
Right.
And the one them way they die also. We see the council don't say they don't respond to the Ministry of Local Government. And the mayor, the other who interview me is say in don't tell in team for left for pick body then up first because of that letter where local government sent to them. So in line with that, who that's in the pick body currently?
Well, that's I don't know that. Not to me. I don't work for the Ministry of Health. I don't work for that coordination. Now, I can tell you, see, government don't form a task force. These are all things they have to look into, right? They had a cabinet meeting, it's on an extensive meeting, and majority of what was discussed yesterday was this crisis. So that could be part of all planning, right? And like I tell you, one great person not going to just go. You go pick body in the street. Yes, it's a good drive, which is great. But if we be the coordinate well, if Ministry of Health was involved, if social welfare was involved, if ONS was involved, if National Drug Law Enforcement Agency was involved, then at the end of the day, all the agencies they are cap and pull the report. You don't get to tell the try for so this one reports and then people down and then pick. Nobody no will question that. But someone who is running for president, someone who's always wants to make this government look bad, so people are using all this as a political weapon for make government look bad, for politics and all that. We are not going to sit down and allow that to happen in this country. This is serious. People are dying. This is an emergency. We want solid data. We want an epidemiology for informed decisions and for informed government interventions. And that is why we believe, say, everybody in this country for come together for love fets this.
So now that make I ask, you say yesterday most of the conversation at cabinet was around this issue of Kush, but cabinet's already informed, say, council don't say they're not the peak body there again. They're informed? If
cabinet, I know they go cabinet meeting, so this are just yeah, but I go know, but not to everything. I know not to everything I go know. There are some things that just those who are in cabinet go know. Not to everything. I just this will highlight that This is what they are planning. This is, I'm not going to tell you, so, oh, if I believe, say yes, because the letter we, Freetown City Council write, they write onto the ministry will get representative, the minister within a cabinet, maybe they will discuss on day. So I believe, say yes, that has been discussed.
Mike, moving forward, with all of these new things, so you talk, say, then discuss in a cabinet, and a new approach will be taken for see how then go put this crisis under control or maybe end them. You want to assure the public, say things will get better soon?
It will get better. Khadija, it will get better. Yeah? And the way we will get better, it takes me, you, we sit also. The city council, the paramount chief, the journalists, them, everybody.
But how the city council will come inside again? The mayor say in the wait now for letting the local government ministry get the new direction.
Yeah, well, when they get a new direction, they under somebody. If they get a direction, say, this is for the good one. They go follow, they go do one. So all what me say here is, this will not for politicize them. Politics.
Anybody they would put politics inside them?
Yeah.
Like who that?
You know one? We they try for politicize them. They try for look at them in a way that government not they do anything. I know they say you support any political party, but the questions you ask is like, we're not doing nothing. You keep diving, you keep diving on that.
How questioning and becomes
that shouldn't be like that.
Political. How questioning becomes because anybody will come here, now follow we ask and question. How does that become
But the questions
political?
and the narratives and the way you go try for bill, that and it makes it look political. And political not means the pass you belong to a party or political can be say you can be political because maybe you have an agenda where they push. And that's how I felt when I came here. I don't feel protected when I come here. Because I feel say I can't share. When I look at on a topic, I can't share me insights. Then if I can, then I'll tell you, say, the first 10 diseases, the way they kill people in this country. Kush no did it. 10 diseases, that is the data I don't give, that are pictorial data I don't give you. Then over 5 minutes, 6 minutes. When they ask me, where the data? Where how many people they don't resolve? Where the data? Where you very well know, say, it is not possible for me to have that at hand here. That is something that you get a data where you sit down now, you get a data of all the people that we don't come now.
When you come, before you come this morning, you check.
I tell you, say,
of that.
I tell you, say, a pictorial data I give you, Mabel. I don't know why when I don't tell you, say, the first 10.
You like the conversation of data, but you not get data for sure.
No, listen, I don't tell you, say, the first 10. Is that not a data? The first 10 disease mortalities.
We don't get the conversation on all the other things in the conversation around Kush.
So when a data they tell you say
Kush not just ask for let you show
what make account and where Khadija talk about priorities.
Numbers. You say the one that we don't recover, but Cooper's the one that we don't die. Then we tell you say give me the data where they inform that statement. And there is no data for sure.
And let me tell you, say I don't have the data here at hand. Right? So I will be glad. No, listen. No, we have to argue because when you look at the 10 mortalities, the first 10 mortalities.
We're not talking about the first 10 mortalities. You say the one that we don't recover, then Bokupas the one that we don't die. But you don't get data for proof waiting you talk.
So you can allow me make I just say something.
Mike, before you say what
before
you say what you say, let me give you a message.
Okay.
I don't try so hard for stay focused on the reasons why you are here and not allow you side talks them for distract me. And I don't try so hard for be so professional having this conversation with you.
And I
don't try so hard for give you all the respect we're supposed to give you as a guest coming to our platform. So please, I expect the same from you. Let it be mutual.
Thank you.
Nobody know they call nobody now with an agenda. Nobody know they call nobody now for embarrass them. We are here doing our job. This is a public platform. And this is a platform we believe say we are free, fearless, and inclusive. And we deal with matters of public interest. So please, let we maintain the mutual respect.
So Khadija, they expect the same.
So go ahead.
Yeah, I expect the same.
To me, best of my conscience, I don't give all the utmost respect this morning. So go ahead now.
And
Not
you know-
further the
and you know-
conversation.
you
We don't
know-
have time.
Okay, and you
for
know,
begin
but
the
you just
good
say you just say
I
something.
gave you a message, so go ponder on them, please.
No, yeah, back at 1 pound on them
No,
right away.
we not get
Where you
time.
see,
We're almost
all right,
9:30.
well, so it's okay. So this is the thing. So also, you just said something. You put me on the spot. Then you know one for make a.
I don't say I'm
redo that.
going to respond.
No, but you put
I
me on the
just
spot.
put
I'm
them
gonna respond.
as
If you tell me, say,
guiding principles of the conversation going forward.
it's okay.
And also, allow you fear say nobody know they ever call you here for
and
embarrassment.
that's how I feel.
Well,
so
you're
validate
entitled
that.
to your feelings.
So validate that. If you feel say something, I am not being respectful to you. That's your feelings. I validate
Alright.
that, and I will say sorry because if you feel so. So if I also feel like you put me on a spot here, I came here to have a conversation on issues where they affect people in this country.
Mhm.
I came here for talk on things them waiting President Bio don't do for make sure say this condition or these issues are alleviated. Then you put me on a spot on a data for let me give you a data on mental health. You take over 5-7 minutes just on that. We call that a gotcha question. That's something. So I get that. At the end of the day, when I cut her, now I go cut, when I put out there, then a trend for likes and for following. That shouldn't be the conversation.
That's your opinion.
You know what? But that's what I felt. That's how I felt.
You might not want
So
for hear this, but I will continue for tell you again.
okay.
Other people and from government on the Kaya, they get a very fantastic conversation.
All
The
right.
most recent one at the Minister of Information, he was so calm.
Let me kind of tell you, say you don't go back. You don't go back. You don't go back to.
You might not want for
you don't go back to
when
that.
we they
That
call
should
you
now.
Naya, nobody no get
would
any
it deviate
perception
conversation.
say they come embarrass anybody.
Alright.
So please, going forward, if you get this perception, kindly drop her now. We they bring
Alright.
Naya as government people for all una to account, Mike. You na public servants.
Alright, so with
The
the wrap
public one for hear
um,
from you. So if we put you now for ask you the question, so you get for be prepared. Question go come up from any angle.
Alright.
It has to be
So we
biased.
dey wrap up the program. But Mike, before you dey left we in the studio, whose assurance you dey left with the public say government they work towards ensuring say wanna get this under control?
I've just said that many times.
Now the
Say
assurance.
I don't tell you. Say
Okay.
President Bio, the government of Sierra Leone, don't put modalities in place for this. It is going to be a long run, right? A long run. But at the end of the day, this could be a thing of the past. And it takes all of us for come together for FETA. We not forget agenda. We not for bent on for say government fail. We for support government. We not for bent on for just point out government in weaknesses. We for also appreciate the things the more government they do. We for also recognize the policies and reforms the more government don't put in place.
Many thanks for joining at the program this morning. That's Mike Berewa. He comes from State House, now the Director of Communications to be there this morning. They share an experience based on medical and also they talk on waiting government don't do for ensure say then put the issue of Kush under control. Well, in this edition of the Breakfast Show, the left on plenty thank you to you. Send your message. You will like and share and tell more people about Liberty TV. Many thanks and continue for share. Until we meet again, get a good day. Many thanks to the production team. Namusa Saukroma make this edition of the Breakfast Show meet you. Mina Mebel Kabade say goodbye.
All right, many thanks to all. We continue for Watch Liberty TV as this now the only digital platform so you get facts about all the public interest issues that they happen at the country. Mina Kadija Bangura, they say have a good day.